Okay, so keratitis. The lecture for today is keratitis. It is one of the lecture from ophthalmology and okay, so keratitis. What is keratitis? Keratitis is defined as the inflammation of cornea. Okay, so what is cornea? Cornea is actually the line or the layer which is covering your color portion of the eyes. Okay, so you can see that this is your color portion of the eyes. Okay, someone may have blue eyes, someone may have black eyes, someone may have brown eyes. So this is all the color portion, and the thing which is covering this color portion, you can see this layer, okay, which has now turned into some opaque color. But usually this layer which is covering this colored portion is usually transparent. Okay, this is actually a picture from the diseased person, but we are going to look at this animated picture. Okay, so this is actually what we are going to talk about. This is cornea, and cornea has no color. It is just like a glass of water. Okay, so you can see things from in and out. Okay, so this is the cornea. It is transparent in color, and it is basically covering this inner layer, this inner colored layer, this iris. Okay, so cornea is the one which is continuous with sclera. Okay, it is part of sclera. Sclera is the outermost part of the eyes. Okay, and when it comes in front of the um, iris, it forms cornea. Okay, so this is sclera, and this sclera is very much in continuous with this cornea. Okay, so this is actually a corneal layer, okay, which we are going to talk about. So when this layer, this transparent layer, gets infected, it forms keratitis. Okay, so what causes this inflammation? There are actually number of reasons and number of causative agents. We are going to talk about all of these causative agents and different types of keratitis. Okay, there may be infectious keratitis, there may be photokeratitis, there may be traumatic keratitis, there may be a number of reasons, so which we are going to talk about one by one. Okay, so first of all, definition. How do you define keratitis? For your information, keratitis is defined as inflammation of the inflammation of cornea. Okay, cornea of the eyes. Now, before you have to know about this, you have to know about the cornea. Cornea, just as I showed you in the picture, cornea is the line which covers the colored portion of your eye. Okay, the iris and the pupil. This is that lining, and it is very transparent. It is it has no color. Okay, so as I have written here, cornea is a transparent layer which is covering the pupil and the iris. Okay, so as I have showed you in the picture, this is the corneal layer. Okay, so you can see your eyes color, you can see you can see people there, you can have your vision through this transparent shield. Okay, so this is actually a shield. Okay, so what causes keratitis? Talking about the causes, depending upon the cause, there are actually a number of keratitises, and there may be bacterial keratitis, bacteria. Some of the bacteria that are very specially known to cause bacterial keratitis include Streptococcus, it includes Pseudomonas, it includes Staphylococcus. So we are not going to talk about all of it, but just for your information, these are the very much common bacteria which causes bacterial keratitis. Okay. Okay, so depending upon each of this cause, this is actually a separate lecture. You can have a long debate on just bacterial infection. You can have a long debate on viruses or the viral keratitis. You can have a separate debate on interstitial and fungal and all of these causes. But generally, we are going to collect all of this information and make one video, so you have to understand what I'm talking about. Okay, so this is bacterial keratitis, and there are a number of bacterias. The most commons are streptococcus and pseudomonas, and then there are viruses which can cause keratitis. Famous virus is herpes simplex virus, and then there is interstitial keratitis. Interstitial keratitis is actually it. What does it mean? It means that the keratitis is caused by some other disease. Okay, there may be some interstitial disease present in your body. It may be like TB, there may be like syphilis, syphilis infection, there may be acanthamebia. So there are a number of diseases in your body, and that diseases then not directly but indirectly causes the keratitis. So that will be known as interstitial keratitis. Okay, and then there is fungal keratitis. So fungal keratitis is very easy. The most common fungus, the fungal infections will be of Candida. It will be of Aspergillus, and then there is the other or type, which is known as traumatic keratitis. Now, traumatic keratitis is caused by a number of reasons. Patient can come and tell you about different stories. Patient can tell you about that I wear contact lenses, and you can have an idea that maybe the contact lenses were not properly washed or not properly. Maybe they were dry. Maybe they were non-hygienic, so they have caused the keratitis. Or maybe the person can tell you about that I was like I was going I was undergoing a surgery, and then I had this injury. Okay, so causes can be a number of causes, but these are the causes that are very, very much important. You have to know about bacterial keratitis. You have to know about virus or viral keratitis. You have to know about fungal and interstitial keratitis. Okay, so you do not have to skip these things. You have to take in consideration and know about the things. Okay, so this was just an example of keratitis. Okay, it may be like bacterial keratitis because there is some kind of pus formation, there is some kind of blur vision. So a typical example of keratitis. Okay, so this just for your information. And then there is this animated eye anatomy. And now we just discussed about the causes. And now after the causes, we're going to discuss about the clinical sign symptoms. Okay, so clinical sign symptoms are very much easy to remember. Some of the very consistent and very common sign symptoms in all of the eye diseases. Your eyes may be red. Okay, eyes may be red. There may be pain because there is infection, so there will be pain. There may be pain. There may be a burning sensation in your eyes. Okay, the patient may complain about burning sensation in the eyes. Okay, so patient may complain about blur vision. Okay, so this is the thing which distinguishes keratitis from other diseases. Okay, so we have talked about like other diseases. Okay, blurred vision. When is your vision blurred? Your vision is blurred when something covers the eyes. Okay, something covers your eyes, like this is when your vision will be blurred because there will be some kind of opacity in front of your eyes. So and on the back of the eyes, this portion or maybe this portion or maybe this portion, they will all will be healthy, but the thing is there is opacity here, so that is why you are going to have blurred vision. Okay, now, how do you distinguish keratitis from conjunctivitis or maybe other diseases? You can distinguish it by this one thing, which is blurred vision. Okay, in conjunctivitis, in conjunctivitis, there were all the things. There will be redness, there was pain, there was itching, there was foreign body sensation, swelling and discharge, but there was no blurred vision. You can see the eyes are very much clear, but in keratitis, you see the eyes are covered with this opacity. Okay, so this is one thing which distinguishes keratitis from other eye diseases. blurred vision, especially the thing to remember to look after in the keratitis. Okay, so other diseases like other sign symptoms like foreign body in the eyes. The patient may complain about something fallen in his eyes. Okay, he may feel like there is something in his eyes but cannot take it out. So this is one thing. And patient may complain about photophobia. Photophobia is actually sensitivity to the light. Okay, the patient, if you tell the patient to look into the pen light or look into the sunlight, the patient will have sensitivity. So this is actually sensitivity to light. Okay, patient will have this sensitivity to the light. They will not be comfortable in looking to the sun or directly to the light. Okay, so very much typical examples, typical sign symptoms: pain, blur sensations, maybe redness, maybe burning sensation, maybe blurred vision, especially in the bacterial conjunctivitis. Okay, there may be foreign body sensation, photophobia, and hypopion. Now you have to know about this hypopion. Okay, let me show you a diagram. Hypopion is collection of pus in the anterior chamber. Okay, so maybe I should not download, I should just show you here. Okay, so what is hypopion? You know that there is this thing. Okay, there is this pupil, and there is this iris. Okay, this iris. Now iris, in between the iris and cornea, there is some kind of empty chamber, which they have not shown in this picture, but let me draw it. Okay, so this portion might be empty in the eyes. Okay, and this chamber, this empty space is then called chamber. So this chamber have this aqueous solution, and it is known as anterior chamber. Okay, anterior chamber. So when there is infection to the cornea, and that infection produces pus in the anterior chamber, this is known as hypopion. Okay, and let me show you a diagram of this hypopion. Let me show you a diagram. Okay, that will be very much helpful. Okay, if I get a good picture right here. Hypopion. Okay, you can see this. Okay, this is the typical example of hypopion. You can see that there is pus accumulation. Okay, there is abscess which is present right here, and let me make it bigger for you. Okay, this is hypopion. You can see that there is this inflammatory there is this inflammatory fluid, there is this pus, and it is settling down in the anterior chamber. Okay, this is hypopion. This is pus. So in bacterial, especially in bacterial keratitis, this hypopion will be present, especially in the bacterial keratitis. Okay, so all of these sign symptoms are of keratitis: redness, pain, burning sensation, blurred vision, foreign body sensation, photophobia, hypopion, and watery eyes. Okay, your eyes will be watery eyes. There will be tearing in the eyes. Okay, I mean to say that there will be more and more tears coming out of your eyes. So all of the sign symptoms. Okay, and then coming to the diagnosis, how do you make your diagnosis about keratitis? Diagnosis is usually done in clinic. Okay, but things like other tests are also important. Okay, so you can do your practice by doing clinical examination. You can look into the eyes, you can look for hypopion, you can look for the opacity in all of this color portion, and that will help you to make your diagnosis about keratitis. But what is the cause of this keratitis? You cannot know it by clinical examination. You have to take the help from the lab. Okay, so what should you do? You should do the fluorescein stain test of the cornea. Okay, how is this fluorescein test done? Okay, so fluorescein test, let me show you a diagram. Okay, fluorescein test, very, very much important. Fluorescein test in okay, so this is fluorescein test. Okay, now you know that normally fluorescein is actually a stain, and you put it in your eyes. But since this stain is not sticky to the cornea, it does not produces this effect. Rather, what it does is that it washes off with water. But once this stain appears green, it means that your corneal lining has been disturbed. Okay, let me show you another diagram. Diagram is very helpful. Okay, diagram is always very helpful. Let me show you corneal lining. Okay, so this is corneal layers. Now inside the corneal layers, you will know that there are layers which okay, they cannot there are not so okay, this one may be good. If I can download it, that would be helpful. Okay, so just make your thing. Okay, make your concept clear about this thing. What was I talking about? I was talking about where is the thing? Just wait a minute. Things are not in the order, but okay, this is cornea and this is corneal layers. Now you can see that there are a number of layers. Okay, the first layer is epithelium, then there is Bowman's layer, and then there is stroma, the very big layer, and then there is endothelium. Now basically there are these four layers, but you know, whenever I put the stain onto the eyes, it will stick to the it will spread on the endothelium. But since this epithelium is not sticky to this stain, whenever I wash my eyes, the stain will wash off again. Okay, so epithelium cannot stick this green layer. But once this epithelium is shredded off, okay, it is scrapped off, and then there is Bowman's layer available. So whenever I put the stain here, the green stain will stick to this layer. It will stick to this Bowman's layer, and when it gets stick down here, it will produce this kind of effect in examination under the light. Okay, so this is confirmation about corneal abrasion of the cornea. It is actually a confirmation of the presence of infection. Okay, so fluorescein stain is very much important to know about the extent of corneal inflammation. If this staining is very dense and very much, it means that more and more epithelium has been disturbed and more epithelium has been shredded off. Okay, it is giving us a signal that there is very much high level of corneal inflammation. And if there is no green opacity, it means that there is no corneal abrasion or no corneal ulcer. Okay, so this is one thing which you need to have in your mind before treating the patient. You are diagnosing it, so you have to diagnose properly about the extent of the disease. Okay, so bear with me if I have told the story very long, but just bear with me, okay? Just to make your understanding. Okay, so then there is corneal scrapping and culture. You also have to do corneal scrapping and culture. Now, what is corneal scrapping and culture? You have to take the layer, you have to take small piece out of this cornea, and you have to take it to the lab and do the culture and know about the organism. If there is bacterial presence, it will be bacterial keratitis, and if there is fungal presence, it will be a fungal keratitis, and maybe God knows what. Okay, so these things are very much important. The one thing is, as I have said, the one thing is fluorescence staining, and the other one is corneal scrapping. Okay, this is how you make your diagnosis. Once this diagnosis is done and the culture gives you result and tells you about the causative agent, you have to treat it depending upon the causative agent. Okay, so if the culture finds out that the keratitis is of bacterial origin, you have to give the patient moxifloxacin orally. Okay, he can take it orally. Okay, oral. And if the patient is he cannot find this drug, he can also use tobramycin. Okay, these both can be used orally, and topically they can use they can use cefazolin drops. Okay, so these are the eye drops. These are eye drops for bacterial keratitis. The patient can use moxifloxacin orally, or he can also use tobramycin orally, and if he is using topically, he can use cefazolin drops. Okay, this is for bacterial keratitis. And if the culture gives you result about viral keratitis, you have to use antiviral drugs. Okay, antiviral drugs like acyclovir, and this can be taken orally. Okay, you can, there is I think there is no topical acyclovir, so you have to take oral. And you can also take drops like vidarabine. Okay, so vidarabine drops are the drops for topical use, and acyclovir are the drugs to be used orally. So this is how you treat the viral keratitis. And if there is fungal keratitis, you use amphotericin B. Okay, amphotericin B is actually a drug that is also used in some kind of parasitic infections, but it will also do the work here. Okay, you can also use antifungal ketoconazole, and if you want to use topical drops, it can be natamycin drops. Okay, this is how you treat fungal keratitis. And interstitial keratitis, now as I have told earlier, that interstitial keratitis is the one which is not the directly inflammation of keratitis of the cornea, but rather it is actually due to some other disease which is present inside your body. So actually, whenever you have to treat interstitial keratitis, you do not have to treat directly the keratitis. You actually have to go first to the underlying cause, and you have to treat the underlying cause. And once the underlying cause is treated, you then have to go back and treat the keratitis conservatively. Okay, and that will be treated. So interstitially, it depends upon the underlying cause. Okay, it may be TB, it may be like malaria, if I'm right, it may be acanthamoebia, it may be Lyme's disease. So a number of diseases, underlying diseases, can cause keratitis, and before you have to treat the keratitis, you have to treat the underlying cause. And then there is one other thing which in all of these with all of these antibiotics, you can also use artificial tears, because artificial tears are very necessary in case of dry eyes. Okay, in case of dry eyes can cause increased friction between the eyelid and the cornea, and it can cause abrasion. So why not use artificial tears? Okay, this is all the treatment. Let me repeat it. Treatment is very much concentrated on the underlying cause. If the underlying cause is of bacterial origin, you have to use moxifloxacin and tobramycin antibiotics orally, and you can also use cefazolin drops topically. Okay. And if the underlying cause is viral, you have to take antiviral drugs and drops like vidarabine drops. Okay. And if it is of fungal origin, take amphotericin B, ketoconazole, and natamine drops, and your fungal keratitis will be treated. And if it is of interstitial origin, just treat the underlying cause. And if it is okay, never mind. Artificial tears are used everywhere. Not a bad thing to use. Okay, so the one thing which needs to be discussed and which needs to be looked after is complication of keratitis. So complication is very much important. You have to treat the disease, or else the complication the complications can cause permanent blindness. Understand? It should be treated very much on urgent basis. And if the underlying causes are not treated, it will lead to permanent blindness. So do not take it to that point. Treat it as early as possible. Look for corneal ulcer. There should not be corneal ulcer. Okay. Who will tell you about corneal ulcer? This thing will tell you about corneal ulcer. Okay. If this thing is very much present, it will tell you about the corneal ulcer level. Okay. Very much be afraid of corneal perforation, and very much be afraid of permanent blindness. Okay. And be very much afraid of scarring of the cornea. Okay. This can lead to bad aesthetics. So this was today's topic. Hope you have understood and gotten the topic. Keratitis. Let me repeat it. Okay. Keratitis is the inflammation of the transparent layer of the eyes, which covers the pupil and the iris. What is the cause of keratitis? Keratitis is caused by a number of reasons. It could be bacterial keratitis, it could be viral keratitis, it could be interstitial keratitis, it could be fungal keratitis, and it could be traumatic keratitis. All of these causes will have some symptoms. What will be the common symptoms in keratitis patient? The common symptoms include redness, pain, blurriness, burning sensation, blurred vision, which is very much the point of diagnosis. And there will be foreign body sensation, there will be photophobia, there will be hypopion. Now, what is hypopion? This term means pus in the anterior chamber of the eyes. You have to know about the anterior chamber of the eyes. Anterior chamber of the eyes is this portion, which is the empty place present just behind the cornea. And there will be watery eyes, tearing of the eyes. Okay. Too much tears. How do you make your diagnosis? You have to make your diagnosis clinically by using pen light examination, or you can also use slit lamp examination. Or to know about the corneal perforation and aberration level, you can use fluorescein staining. What you have to do is you have to stain the eyes with fluorescein and know that, and then wash it. And after washing, you have to look into the eyes under neon light. If the color is like this, if the stain gives you greenish color, it means that corneal perforation or corneal damage is present. This will tell you about the extent of keratitis. You can also do corneal scrapping and then culturing that scrap. Okay, this will also be done in the lab. And what is treatment for keratitis? Treatment is mostly concentrated on the underlying cause. If the underlying cause is of bacterial origin, you have to use these broad spectrum antibiotics with cefazolin drops. For viral keratitis, use acyclovir with viridibine drops, and for fungal, use amphotericin B and ketoconazole and natamycin drops. Interstitial keratitis will be very much concentrated on treating the underlying cause, and with all of these things, take the help of artificial tears and be aware of complication. It can lead to serious damage. Thank you very much for listening.